Jesse, Matt, thanks for organizing a great conference. And Dora and I are new to media economics. We'll see if we're invited back. This is going to be a paper at the intersection of urban economics and media. And we've been told we have a great title until you hit the clause. So just think of us as death in the media, and perhaps all these other words should go. We will let you guys vote. So first, after a great lunch, why study typhoid 100 years ago? I think that that's a reasonable question. So we're going to study a time period in American cities, but the same thing happened in Germany and England, where there was really horrible trouble from dirty water, of a major public health challenge, a major externality of people dying from typhoid. And today it's a major challenge. I go to India next month, part of the MBR crew, and just took all these shots. I'm a big baby, it hurt. And in part to reduce the probability that I get typhoid. An interesting part of our paper and our data collection efforts is that we can track, using these public health reports, death rates on a weekly basis by city. We're able to track objective reality of knowing what's going on within a city with respect to its public health challenges. We're going to have a very simple model of the supply and demand for news. Urbanites have strong incentives to be informed, up to date with typhoid news. In a simple Ehrlich-Becker model of self-protection, if people are aware of the risks they face, they can engage in costly self-protection, which I'll tell you about in a couple of minutes, to protect their families from typhoid risk. As Cutler and Miller have spoken about, in our 6 cities, the government is going to invest in big public projects to reduce death rates to reduce exposure to typhoid. We're interested in how the media covers the evolving story of typhoid over time. So our study is really going to be about the supply of news as time passes, and as a threat goes away, is good news covered, or if it bleeds, it leads. Folks, some data, and I hope you can see this. We're graphing death rates. From typhoid. I'm not going to get the units straight. Our time period is going to be 40 years, from roughly 1890 to 1930. And here we name our 6 cities. And what we want you to see, and this has been well documented in the literature, is that there's been sharp reductions across all cities, especially Philadelphia, in reducing typhoid death rates. And so this is a time when there was huge public progress on this deadly matter. And from a table from the paper, so the way to read this is these are typhoid death rates per week per 100,000. So if Baltimore had 1 million people, 7 people were dying each week in Baltimore before the early public health interventions. And this fell to 1.5 people, if I could turn people into a divisible, at the end of the period. So roughly an 80% reduction for Baltimore, and similarly for all the cities. So over this 40-year period, tremendous public health progress in fighting typhoid. Quality of life in our cities improving. So to bring this to economics, our paper is an empirical paper, but thinking about the supply and demand for public health news. And folks, in our reading of the media literature, I'll come back to this point, relative to other news articles, news about the Iraq War, news about fiscal stimulus multipliers, is public health news less biased? Is something that interests us? Does everyone just want to know the facts? We are going to have, for 6 major newspapers, and folks, a weakness of our study is we're not able to get multiple newspapers in the same city. I wish we could have done that, and I will leave it to our jurors how much you're going to hold this against us. But for example, the New York Times, does anyone here read the Chicago Trib? These will be the types of newspapers we'll have, but we don't have the New York Post. We're going to, for 6 major newspapers across the 6 cities I just showed you, we're going to be taking a look at the count of typhoid-related articles over 40 years on a weekly basis. We're going to incorporate an event study methodology because each of these cities invested in major water treatment facilities during this time. Folks, this is a negative externality that every family trades off wanting to be healthier, and is more likely to be healthy if it invests in making costly self-protection of boiling water, taking steps, having clean bathrooms to reduce exposure to typhoid. But health is also a function of public investment and also local shocks to the water supply. What we're going to be able to do in a revealed preference setup is study. We're not going to be able to recover structural estimates of what were the goals of the newspaper. I think that that might be a more ambitious approach. But in a revealed preference setup, we're interested in how local newspapers reveal, how they cover this story during this time when death rates are falling. And I already mentioned this media slant point. What I think is rare in what we're about to set up is being able to simultaneously see how objective reality, these death rates across cities are evolving, and how the media covers this consistent apples-to-apples comparison. So folks, our 4 questions, which have turned into 6 questions. Question number 1. When typhoid death rates are up, the media is more likely to cover this story. And yes, we will document evidence of this. We're going to test the lulling hypothesis that after cities invest in large water treatment projects, the media stops covering typhoid. Problem solved is the hypothesis we'll be testing in question number 2. In question number 3 and 4 is cut off down here. In question number 3, we're going to take a look at the following. When there's an uptick in typhoid death rates, after the interventions have occurred, does that lead to an even larger coverage that our story is that everybody is surprised that this threat which they thought was solved is back, and that this generates news? And in 4, we're gonna follow, does everyone remember fondly the new news literature? So in the 1970s in macro, guys were asking what's unexpected inflation? And you had to detrend things, and those were exciting days. Does anyone yearn for those days? And so I can name some Barrow papers. I don't see him. I'm on tape. Guys would detrend things and say, that's new news. And so we're going to be like those 1970s guys of saying, if people know that typhoid continues to be deadly, is it new news if the death rate's high? In a similar new news spirit, we're going to engage in basic time series methods to try to recover an estimate of unexpected deviations in the death rate. And we're going to hypothesize that when there's an unexpected increase, and this takes us to the asymmetry in our title, when there's an increase in death rates, that relative to expectations, that generates a lot of news. So let me tell the typhoid story, and has everyone digested their lunch? So typhoid is about dirty water. You can vote with your feet. I can take a punch. And so typhoid is about contaminated drinking water. And here is Dora's list of the other ways to pick these up. So we have some pictures from the past. The incidence of adapting to typhoid risk, I don't think it's too controversial to say that this is mostly on home production and the mother in the house. The steps to take, I believe all of this would take physical effort and resources. And Matt, I interpreted your question about fixed cost versus variable cost. So if I could just purchase a smartphone, that would be a fixed cost with no variable cost. This would take, let you ask your question again. These would be variable costs that are costly for the mother of the house that would be incurred when a typhoid outbreak occurs to reduce exposure for your family.
So the question I was going to ask, I guess, is just to what extent are these things that were actually common? So like, you should boil your water. Is that one of those public health recommendations that 0 people follow? In which case, these are not that actionable. Like the welfare impact of coverage via changing people's behavior might be quite small if nobody's doing these things anyway. Or do we know anecdotally that there's some effective prevention measures that some large share of people are taking? And so there's a really
So I want to argue that there's people at the margin. And if Dora were here, she would already have thrown me off the stage and said, let me take over. Because no one wants to hear me talk about economic history. But Dora convinced me and that there were people at the margin, that these were steps that were common knowledge. Can anyone date Louis Pasteur? So we are interdisciplinary. So I think we had a germ theory of disease, and that this was generally common knowledge, and that these were steps that Matt asked the right question. I don't have microdata on adjusting on these margins, but implicit in our work, for the media to have a causal effect on reducing death rates through private action, it has to be that households are moving on these margins, but I don't have microdata here. So I can't answer Matt's question. And I guess we're done. But a very important question for incidence. So folks, our 4 hypotheses, and I'm just repeating these but with more detail. We're going to study whether this increase in typhoid rates leads to more news articles. And again, what excited me in our project, this project started when I was in a car with Robert Fogel. And Fogel was mentioning his optimism about long-run progress in our standard of living, but that somehow the media doesn't cover this. And that discussion with Professor Fogel just stayed in my mind for years until it dawned on me and Dora that the urban public health literature gives us an opportunity to test that. And so it interested us to be able to track from public health reports the dynamics by city, by week, over a 40-year period of public health progress. And folks, a point I should bring out is the media coverage we're going to study is not a direct function of this death rate. The media, and I'll show you this in a couple of minutes, the media isn't just saying, oh, the public health authority announced the death rate. Instead, we view our project that we're able to track objective reality of typhoid challenges by city, by week, by year, because we have this death rate and case rate data. Hypothesis number 2, which I mentioned a moment ago, after very costly, and this is Cutler-Miller's work, after very costly public goods expenditure, does the media move on to other issues, saying this problem is solved? That people say, yeah, we trust government. So this is sort of a crowding out hypothesis. If that public investment in typhoid protection is a substitute for private self-protection, if the government has invested in public goods to provide this service, does both the media and people say problem solved and they move on? And we're back there again. Conditional on hypothesis 2, after these interventions, when people think they're in a safe period, is it the case that when there's a new typhoid breakout, that there's a lot of media coverage? And our story there is this crowd hypothesis, that the public has potentially been lulled into a false confidence that this problem has been solved. And then when there's a new typhoid breakout, that the media covers this story. And here we offer some additional possible explanations for this hypothesis. And of course, I'm just rushing to get us to the data. And hypothesis 4, which I mentioned before, when you detrend, when we say we test whether the media doesn't respond to death rates, but to innovations in the death rates above what would be predicted from a simple time series model. And that's the 4th hypothesis. Our empirical strategy, and this is a reduced form paper, is we're going to be estimating these zero-inflated negative binomial models. During 20% of the city week years, there's going to be 0 articles in our 6 newspapers about typhoid. So we've got a bunch of zeros on the order of 20% of our data. We're going to be estimating some zero-inflated negative binomials as a function of, so our key dependent variable is the count by city, by week, by year of articles about typhoid, mentioning typhoid, and I'll talk about our data in a moment. We're going to be running regressions of this on the death rate in that same city, year, and week. And we're also going to be having these dummy variables for whether the city has invested in its public water treatment investments. And this interaction between the two will allow us to test hypotheses. And we're going to fail on one point. So in a zero-inflated negative binomial, the model has 2 pieces, the probability that there's 0 articles that week, and then modeling the count of articles, conditional that that's a positive integer. Building on Stromberg's work in the media, we had thought that if it was especially a newsworthy week, the World Series is that week, there's an election, we had thought that you'd be more likely to have 0 articles about typhoid. And so a puzzle in our econometrics, if you read the paper, is that unlike Stromberg, we didn't find a crowding out effect. And Dora has some theory, well, she's going to see this tape. Dora has a potentially correct theory of why we find the results that we do, but I found that troubling, but I will hide that from you. Our second empirical strategy will be this taking out this mean of defining new news as the current death rate in the city minus what was a conditional expectation. Folks, we've gone back and forth on how to operationalize this, and we can take your beating, any suggestions you have to improve this. So one thing we did is we just take a rolling average and calculate over the last 2 years what was the average death rate in that city, and then subtract that to get the innovation. We also estimate an ARMA11 and use that simple time series model to predict this, and then a positive deviation is just a positive residual, current death minus predicted death, of saying in which cities, in which weeks, relative to expectations, was there a positive typhoid death rate, and that would be bad news. Our data, and this took a lot of the time. So in New York City, we have really good death rate data. So folks, we're gonna have typhoid and diphtheria. Diphtheria is gonna give us a placebo test that I'll tell you about in a couple of minutes, which I think is kind of fun. Our data, so there's 2 pieces to the data. There's the weekly death rates for our 6 cities, and 6 major cities in American history. And then what we did with newspaper articles was we first hand collected them, and then we mechanized the search. Our 6 newspapers, does anyone subscribe to the Baltimore Sun? Tough group. Boston Globe, I used to read, Trib, Times, Washington Post. We have 1 newspaper per city. And using these search engines, you're able to just type in words and then see what is the count that comes back. An important thing we're going to do here is we're going to count typhoid articles, but we're also going to partition articles into whether it's a local story or a national story. And a local story would be one where in Chicago, if Chicago and typhoid are both mentioned in the article. There's a literature in urban economic history that might interest you that Werner Troskin has argued that white communities provided cleaner water to African American communities adjacent to them because of fear of spillover. And so I thought that that's a very interesting literature of when there's a potential urban externality of when is one group willing to transfer resources to another group out of self-interest. But we had not thought about John's point about cross-city. And so it would be interesting we implicitly in our econometrics are treating these 6 cities as islands, and we can think about that. Folks, Dora gave me a couple of articles of what we're dealing with. On the left, it says typhoid in oysters. Commissioner Letterly discussed typhoid fever situation here yesterday. Don't eat oysters. Tough crowd. Over here, here's Senator Hanna having typhoid. And so this is the flavor of what the computer is doing as it's reading through these articles. At first, we were paying research assistants to read all these things. But then I'm going to show you man versus the machine. And we can see how such searches do. This is the flavor of the zillion things we were reading. Our typhoid panel. So folks, 6 cities for roughly 40 years, and we're not cherry picking the starts. The data limitations pin us in, but we've tried to have a balanced panel. In our mechanized searches, as I just mentioned, we're going to be counting by city, by year, by week, all articles mentioning typhoid, and all articles mentioning typhoid in the city. These will be our measure of local articles. The excitement is building. So folks, how do mechanized searches do? So let me help everyone, since this is a tough room. Time goes from 1900 to 1930. Percent of typhoid articles. As I was staring at this morning, the newspaper doesn't have that much news about typhoid. But folks, take a look at the black line and the red line. The black line was our manual searches. The red line was our mechanized searches. And so these computers, with these computerized searches, we did a very good job at the national level. The green and blue line are local searches. And you guys are going to say, boy, oh boy, you guys, this is a little more stinky. And here's the story. With local articles, there could be cases. What we're finding is we're finding more local articles in the mechanized search case. And this is the computer being unsophisticated and just seeing it not being, a person who read the article would immediately see that it's not a local article while the computer's just following this rule. Folks, I mentioned that each of our cities engaged in, so the point of David Cutler and Grant Miller's work on urban public health is that major cities in the US have issued bonds. So Cutler and Miller had a very interesting paper that the rise of the ability to issue municipal debt allowed cities to finance enormous public goods projects that improve public health. And here are the dates for the cities and the actions. And I'm supposed to show you a picture of this remarkable infrastructure. If anyone sees their ancestors. So this offered some stimulus to the economy at the time. And this is all big ticket stuff costing a lot of money. Folks, these interventions were effective. If you take, say, for Chicago, what we're finding is, so Chicago, this second intervention, maybe let's do Philadelphia. In Philadelphia, what we're showing you here in table B1 of the paper is a very sharp reduction after the first intervention of typhoid death rates, and that these public investments were effective at reducing the death rate. Matt?
Could you give us a little bit of the background on the political economy of these interventions? Was there a party divide in supporting them or opposing them? Was there a constituency? If you looked at people across the political spectrum, was there debate about whether these were worth the investment, not worth the investment?
We do a weak job there. That the one way we explore that at the end of the paper is we study whether the editorial pages of newspapers were lobbying for these investments, and we don't find much evidence there. And so there
were no editorials one way or another.
So let me show you that now, since that's my only smart comment. We go to the editorial pages for each of these 4 newspapers. For the other 2 cities, there were no editorials. And we're making histograms of was the editorial page of the newspapers talking about these issues beforehand. Because at the end of our paper, we're going to study whether the media can cause reductions in typhoid death rates by changing public policy or by changing private self-protection. And Matt, I can't really answer your question, but when we study we don't believe that the editorials played an important role in nudging forward these investments.
Do you know whether these editorials were pro or con?
No. We can do a better job there. In Chicago, there was a campaign of why the cleanup didn't occur sooner. And in Washington, D.C., and maybe this comes back to John's point, they were mostly about other cities' actions. We can do a better job there of whether we do not talk in the paper about the political slant of the editorial page in that year and whether the 2 parties were in unison on the issue. And we can do better. We're going to include in some of our regressions year fixed effects. And so in some of our regressions, we'll have year fixed effects, and the variation will come from within year, within city, the death rate rising. But your point's a nice one that Dora and I haven't discussed. Folks, a point of confusion, if you read our paper, something I don't understand in my own paper, and maybe you should never admit to this, is if you're looking for a sharp regression discontinuity, the black line in these graphs is the death rate. And when cities begin their water treatment plans, you don't see a sharp break at these dates. So I showed you using regressions from the event study regression approach that the death rate declines. But even in Philadelphia, there's a drop in the death rate, the black line before the intervention, which then continues. And so this has been a puzzle to me.
Have you looked at investments in just plumbing infrastructure and stuff like that? It's all very well to have the Ashokan reservoir, but it needs to actually get to people's homes.
So John, we are dating, so just say that again. So we are dating this as a date when the infrastructure is available. So John, can you ask your question again in the context of these dates?
Well, so in 1915, the Ashokan reservoir comes online for the New York Basin, right?
Yes.
And that provides very clean water to the urban area.
Yes.
That, to be effective, what that water needs to do is to actually get to people's taps, right? So if the Ashokan is only supplying water to the South Bronx and Manhattan, it's not helping deaths in Queens very much.
I agree. And Dora's point is that much of New York City already had clean water and that this helped the outskirts when this was introduced. But so if everything you're saying is right, what would be the implication for the time series graph for New York?
What you're seeing is the rollout of plumbing to the home infrastructure.
Yes. Yes.
There's a bunch of complementary investments that are made more gradually over time that have to go together with these big lumps that you're looking at.
So thank you. So maybe that's a good explanation for why we don't see sharp discontinuities. So thank you. So again, to results. I'm going to show you, because these zero-inflated negative binomials are these nonlinear models, and we've got a bunch of interactions, to make these after-lunch digestible, I'm going to be showing you marginal effects And we have 3 different specifications, because Dora said that's what we were going to do. And they differ with respect to what fixed effects we include throughout these models. But it leads to a little bit of table sprawl, which, so here we go. Folks, I'm reporting the marginals here, so let me help everyone. This is the world's greatest title, Average Death Rates, Interactions, and Death Rate Interaction Marginals from Negative Binomial Regressions of Typhoid Death Rates on All and Local Newspaper Reports. Not my idea. I just wanted to call it worms or elephants. I'm kidding. So folks, here's what we're going to do. I'm going to claim that this column is a test of hypothesis 1. This column is a test of hypothesis 2, as I'll explain, and this is a test of hypothesis 3. So let me explain. In specification 1, which has fewer fixed effects, but we're including more and more fixed effects as you go from 1 to 2 to 3 to not hide anything from you. Our first hypothesis, if you remember, is as the objective death rate in a city year week increases, does the count of articles about typhoid increase? And the answer is yes, both for all articles and for the subset of local articles. So we find evidence in support of hypothesis 1. Folks, remember hypothesis 2. Hypothesis 2 was after the interventions. This is this horrible notation. I1 is a dummy variable if the first big city public intervention has happened, and intervention 2 is if the second one has happened. In the aftermath of the 2 interventions, holding the death rate constant, there are fewer articles about typhoid. And this is measured in counts of articles per week. There are fewer articles, this one's statistically insignificant, there's fewer articles each week about typhoid. So support, this is our evidence on hypothesis 2. Folks, on hypothesis 3, and to remind you what that says, after the 2 interventions have happened, and thus this is a time when these cities have made great progress on typhoid, and to Andrea's point, maybe also with this vaccinations, we need to do more there. When there's an uptick in the death rate, there's much more news coverage, is what we're finding here. And so again, 3 hypotheses are shown in all this mess. More coverage when the death rate is up, less coverage of typhoid after the 2 interventions, more coverage of death rates after the 2 interventions have occurred. So to bring this back to media economics, again, when the government invests in a public health project, is it no longer news? So folks, I'm working on climate change adaptation. In coastal cities, if enormous seawalls are put up to protect cities, are people lulled into feeling safe? And then when you have a Katrina, is that a hugely newsworthy story? So I'm very interested in whether public investment crowds out, again, this lulling hypothesis of crowding out the belief that we're safe and that actually endangering us because we lower our guard.
Is it the investment that's crowding it out, or just the fact that nobody's dying that's crowding it out?
That I can't answer. And so that...
Some of those lulling stories would be the same if, for some reason, typhoid disappeared for a few years versus we built
You'd be less likely to believe that it's a fluke if there's this capital technology, but maybe I'm assuming too sophisticated an agent. So if you have 6 months of no flooding, is that good luck? But Matt, I understand what you just said, and we can think about that. So for those interested in the size, the effects are pretty large. So the experiment we run is we take our marginal coefficients and we ask for a half standard deviation increase in the death rate before and after these city interventions. What is the increased count of articles related to typhoid? And we didn't have any intuition on how big these effects would be. They are what they are. Our 4th hypothesis relates to this new news hypothesis. And folks, this table's a little hard to read, so let me explain. We had 2 methodologies for defining new news. This rolling mean, so a deviation from the previous 2 years, and these ARMA models. Ignore this. What this says here is when there's an unexpected increase in the death rate, that the death rate is positive, we're seeing a very large increase in media coverage. So this is this 4th hypothesis that when it's new news that the death rate is high, typhoid articles are much higher. And you can read these results here. I'm down to about 9 minutes and have some other things to tell you. That again, in our title, you remember the exciting word asymmetry. I'm slightly rushing this, but that these coefficients are much larger than these coefficients is our evidence on asymmetry, that when it's bad unexpected news, the media is picking this up much more than if it was good unexpected news, that the death rate is unexpectedly low. Folks, we have a placebo test in the paper. I flunked out a pre-med a long time ago. Diphtheria is another infectious disease, but this is from spitting and from the lungs. And so what we were up to here is asking if the diphtheria death rate rises, are there more typhoid articles? Folks, MBR folks, do you give that a B+ as a placebo test? Call myself Richard Freeman? I guess not. And so this is our attempt at a placebo test. What we find, actually this will interest media folks. Folks, when the typhoid death rate is higher, diphtheria counts of articles actually go down. And so that interests me, coming back to some of our discussion of crowding out before. So not only did we pass our placebo test that we don't have more diphtheria articles when the typhoid rate is up, but the count of diphtheria articles is actually down. So I give myself an A- for that. That's a good grade at Chicago. Folks, because Matt led me here before, let me set it up like this, but I have about 5 minutes and then I'm done. We've documented the causes of typhoid coverage. I now want to say two smart things about the consequences of typhoid media coverage. Back to Matt's questions, the editorial page, we do what we do and we dismiss the hypothesis that the media is causing public health progress, but with the editorial pages leading the adoption of the Cutler-Miller investments. But we can do more there along the lines you gave us comments. Now something smarter. If it's the case that you read in the news that typhoid death rates are up, 2 or 3 weeks later, do you now take I'm sorry, I said that backwards. If it's in the newspaper that there's articles about typhoid, do people increase their self-protection such that death rates subsequently decline? So now we're turning this regression around. And folks, now we do something smart, and I give Dora the credit for this one. We instrument for the total count of articles in the newspaper about typhoid using the non-local articles. So again, our instrumental variable strategy, this is bad notation, but controlling for city and year fixed effects, we're asking, do future death rates, are they negatively correlated with current news about typhoid, instrumenting for current news about typhoid from non-local articles? And so this isn't just a persistent contagion effect. And what we find there is a little bit of mush, but if you look in the paper, it's either table 12 or 13, a series of negative correlations that are statistically significant when we don't include lag death rates, but which are negative but not statistically significant when we do include lag death rates. And so suggestive of households increasing their self-protection when the newspapers are writing about typhoid. Why does the media matter? So I work in environmental and urban economics, and you might say I should go back to those fields. Let me say something slightly smart here. The media spreads public health information. It causes individuals to increase their self-protection. Because there's a negative externality, a role the news plays, and I'd ask Matt and Jesse whether this has been explored, is to coordinate individual activity, because the newspaper treats all readers. We're usually used to treatments being individual. You get randomly assigned to go to Harvard rather than Stanford or something. But here, the newspaper treats everybody with the same information, solving a coordination problem. What interests me very much in our setting is when I was a Sherwin-Rosen student working on differentiated products, cities as differentiated products, the exogenous attributes of a city like San Francisco was its weather and its coastline. But when you have a city with contagious disease, you've got these high-frequency endogenous attributes, so which are changing over time, and will people make better choices if informed? If the media is not covering the public health issue, then renters could actually gain. As typhoid rates decline in the worst parts of these cities, if the media is not reporting on this progress, then renters could gain, because outsiders who are not informed about this progress are unlikely to bid higher for this such real estate because they're unaware that the local public goods have improved. And there was a hand. Yes.
Yes, I have a question for why you chose those particular 6 cities, specifically bringing in the regional aspect and dynamic for how that could have affected the rate of typhoid, and then also in terms of what interventions might have or not have been made in smaller cities.
So those are great questions. At the time in American history, those were 6 major cities, and it was partially data opportunities that we had the newspapers and we had the public health death records. It would interest me very much to do this in other cities and to do this in other nations. So these were major cities at the time. I don't know if it could be done in Los Angeles. Folks, thank you very much.
So my maybe only claim to fame is that either I'm old enough or I come from a sufficiently underdeveloped country where this stuff is at least in my collective memory. So as a sort of two factoids that might be interesting. So my grandfather was born in a small town near Venice called Chioggia, and he was a family of 11. I think 2 died of diphtheria, and his mother died of typhoid. And this was a major issue for the family, so much so that my mother grew up with the sort of habit of boiling water and not drinking a lot of water. So when my kids, raised in America, went back, my mother, their grandmother, would be very strict in giving them water because water was something dangerous. Now, of course, all the public health information in the States says exactly the opposite. But if you grew up in a place where sort of typhoid was very diffuse, water was dangerous. Now, the thing that is not mentioned as a remedy, which is actually a pretty important remedy, is not to drink water, but to drink alcohol. Because alcohol is actually very safe. No, seriously, I'm not joking. Beer and wine and even whiskey have a lot of other issues, but they don't give you typhoid. And that was this gives an opportunity, actually. If you want to think of a micro level sort of adjustment, you should see beer consumption going up when people are more afraid of the water. In Venice, there is this saying that the water destroyed the bridges and wine never destroyed the bridges. So there is this, but of course in America, this is not considered politically correct. Anyway, after this story, I have to say that, of course, this was a fascinating paper, use of historical data, to address a sort of interesting question that is what fits to print. And it says, you know, the New York Times, all news that fit to print. The question is, what really is fit to print? And there are a lot of things that is very rich data set, very clear analysis, and I think is well done from a technical point of view. So Matt has already pointed out sort of the major findings. Let me sort of summarize them here. One is that news are positively associated with the typhoid mortality counts. That's not surprising, but it's good to see that. And sort of the size of this effect, and this is more interesting, the size of the effect grew after the local newspaper, after the local cities improved the water quality. And it's a bit like a man biting the dog is news, but a dog biting a man is not news. And if a lot of people die of typhoid, it's not particularly an interesting news. Once this becomes rare, then maybe is an issue. And then there is the issue about sort of the coverage, and in particular, I think that consumers find bad news more useful than good news. This is one of the interpretations. Now, I have 2 quibbles with 2 aspects, and then some sort of broader comments that are maybe more specific to the literature than to the paper itself. So in terms of quibble number 1 is the technological assumption is sort of they justify the trend and the result under the assumption that information about poor water quality is more valuable after the clean water intervention because at lower levels of self-protection, the rates of return is sort of increasing in self-protection. Now, this is definitely true if the acquisition of news was on the margin, but I think that buying a newspaper and reading about a newspaper is mostly sort of you don't really moderate how much you read. It's more either you buy or not buy the newspaper, and the newspaper either to report the news or doesn't report the news. And so the question is, on average, what is more valuable is not on the margin what is more valuable, but on average what is more valuable. I suspect when the possibility of dying of typhoid if there is an epidemic is much larger, this is very valuable. And when is only sort of limited, then is less valuable. So I'm not so sure that I will predict those results. And I wonder to what extent is sort of the model built after seeing the results, or what extent is it the other way around. So I'm not sure what is tested and what is the result. And in this sense, I think that you can look at more direct evidence of compensation. This is where my beer and alcohol consumption is interesting, because if what is reported in the newspaper is more like an entertainment news, so if you think about the Ebola coverage in the United States last year, probability of getting Ebola was pretty low in the States. So it's not sure that this was news you can use, but there was coverage every day and massively. Why? It was entertainment, because it was like so dramatic, so unexpected, so sort of shocking that people were looking at it. So if the sort of news are reported for entertainment value, then you should see sort of not much of an effect of on the alcohol consumption, but maybe you should see a high increase in consumption before the water treatment. If it's really news you can use, then you should see after the water treatment. So you can use sort of alcohol consumption as a proxy for that. I don't know how good the data are on, but this is the privilege of a discussion. You can sort of give stuff to do, and you're not sure how easy it is to do. Then the second point that Matt was very upfront about it is that here there is no evidence about competition, because data are not provided. Now, what I would have liked to have seen, I understand that this is a cheap shot because data are not there, and it's inconceivable that they collect this data just for this purpose. What I would have liked to see a little bit more is what was the coverage of those newspapers at the time, because he sort of said a New York Times versus New York Post. Today, clearly, New York Post is basically a trashy newspaper. New York Times is a serious newspaper. It's not obvious that in 1890 that was the case. It's also not obvious, in my view, what was the cover. This is my recollection of some readings of media, is that the market was much more fragmented back then, and in particular was ethnically fragmented. So, because remember, a lot of people were not speaking English, so in New York you will find an Italian newspaper, probably an Yiddish newspaper, and an Irish newspaper. Now, Irish is probably the same, but sort of very ethnically fragmented. And so what interesting question is this stuff was not effective equally the same sort of the town in the same way. So did typhoid affect more the Italian neighborhood or the Chinese neighborhood, etc., was more reported? So that will impact dramatically, sort of because the New York Times probably was catering to a part of the population. Was this population really affected by typhoid or not? So I think that that's something that they can say something about it. Now, not being an historian, I still love the use of historical data for a number of reasons. Number one is because if you are interested in natural experiments, there are only so many natural experiments you can get with the sort of contemporary data. So getting some historical data, these are very useful. The second, which is what David Stromberg has done, what I've done, what other people have done, is that in time where there was only newspapers, there was no TV, there was no radio, you have a much better control of what's going on. So in that sense, this is great. But the last sort of aspect is that the great things about history is that, especially if it's past enough, is less controversial, and so can be analyzed in a much more ascetical way. In a Latin historian was saying sine ire et studio. Now, studio, for those who knows, means passion, because the word student means actually somebody with a passion for something. I know that today this has lost, but the idea is you can analyze things in a much more objective way when they are historical, because the political controversy is gone. I think that this paper misses the third opportunity. I think that already Matt anticipated me with the political economy. There is a very interesting political economy story that because the parties party to these things are well gone, is sort of you can analyze without getting in trouble, but I think is definitely worth looking at. The second thing is that Matt and Dora seems to subscribe to a very Panglossian view of the media. They sort of start with this assumption. We assume that consumers demand to find information and that the media provides readers with the information they want. So it's a very sort of, if you want, mechanicistic view of the media that makes the media not particularly interesting. So it's a bit strange, and they're not unique in this. It's particularly strange that people studying media, they want to take a view that makes media sort of like toasters, not particularly interesting. So what are the consequences of this? So one is, of course, the view that media provide only the news you can use, and I already anticipate that. It would be hard to understand why people read the National Enquirer, because I don't think that there is much you can use there, or because you sort of brought news about the Ebola. But more importantly, I think that there is this component, which I call psychological or whatever, of the news, that you are more attracted to things that are abnormal. Amartya Sen said that famine is much more newsworthy than endemic hunger. And so I think that it would be interesting to sort of develop and test an alternative. You are basically only the news you can use, and you find some positive coefficient, you claim victory. I think it would be interesting to know how much of this is explained by news you can use, how much is explained by other. Especially because if I look at your own pictures, I think that this is the value, and they should be praised for exposing those pictures, because I think you can learn a lot. You see, for example, that a lot of the stuff is non-local news. So the fact that if I am in Chicago, there is some typhoid fever in Washington is not really of great interest from news you can use, is something else. And so I think that this distinction is the part that I would like to explain more. The second is, of course, the issue about political economy of water treatment, what Matt already anticipated. Who wanted not to publish the news about typhoid? This is where the stuff gets interesting. So was the government trying to cover up? Or a real estate developer, if I'm a big sort of landowner in an area that is affected by typhoid, I think that those news are not good for me, and so I try to cover it up. And who had an interest in pushing them? Of course, construction companies. If I want to sort of sell the stimulus package of the day, I will go around saying that this is a great improvement to this. Or maybe because now I learned that we're financed with bonds, if I'm selling bonds, I really want a lot of news on typhoid so that this stuff gets done. And of course, it's not only self-interested, especially at the time there was a progressive, this is basically in the middle of a progressive era, so there are people exposing this and making a business of exposing this. And there are a lot of educators that are into sort of health economics that try to teach people what to do and etc. So those are clearly sort of this. So how reporting different from facts? So the pictures that we show is that death and reported news are not correlated one-to-one. So there is a distortion, and the question is the distortion simply the effect of after 10 weeks of news of typhoid, we're sick and tired, and even if half of the city is dying of typhoid, we want something else? Or is the fact that there is influence groups? And what is interesting is that there are quite a lot of differences across different towns. So if you look here, you see that in Baltimore, there is a huge difference between news, and you can use the difference between local articles and general articles to the extent this is not just a coding error, but it's true, as a proxy of there is an agenda here. If we see massive sort of coverage of non-local typhoid is because of two reasons. Either people are obsessed with typhoid for whatever reason, or there is somebody that is really want to push for a change. So like here in Baltimore, you see that there is a huge pressure, and then there is the chlorination down in Baltimore. It's strange that the two things are sort of not really correlated, especially because after that you see a decline in coverage of news. Now, could be because the death declined, or simply because the interest they were pushing for chlorination sort of disappear. In Boston, you see sort of a peak here before the introduction of this dam. You see a peak in coverage of non-local news. So it's not that people are dying by the millions in Boston. It's that somebody is putting in newspaper a lot of news not related to Boston. So the last thing is, of course, the effect of media reporting on public work. It seems that in Chicago, at least for the second chlorination, it seems that this might have an impact, because sort of you see, again, the surge in information that is non-local, and then some public work. Again, seems to me strange that this is just a coincidence. So concluding, I think it's a very interesting paper. I think it can be made even more interesting if he abandons the Panglossian view. And I have a question, especially for the sociologists in the room or the people more interested in sociology. Media economics is not the only subject of economics where experts tend to conclude that the subject is worthless. And it says, if you think about corporate finance, started with Modigliani and Miller, said that finance doesn't matter. Okay? And our colleague at the law school started saying that law doesn't matter. And it actually was the finance people saying that law matters, because the sort of law people said law doesn't matter. And you can go on and on with this. And it's a question of why. It seems to be a bit of a self-defeating agenda. Thank you very much.